Hello, everyone. You are joining Ask a Care Navigator, Mondays with Maureen. Hello, everyone. Today is Monday, July the 28th, 2025, and you have joined this program that we offer on most Mondays to talk about issues associated with living well and aging well, and perhaps how Four Seasons, the care you trust, may be of service. If you have any questions or comments, please call us at 866-466-9734, or please go to our website. There's a lot of information there, and that is fourseasonscare.org. Please spell out the number four, FOURSEASONSCARE.org. Well, you may recall if you've been following this program for a bit that I'm reintroducing Four Seasons services. And today I'm joined by one of our senior leaders, Ryan Cannon. Hi, Ryan.
Hi, Maureen. Thank you for having me today.
Thank you. Tell the audience a bit about you.
Yeah, happy to. So, as Maureen said, my name is Ryan Cannon. I serve as a Chief Innovation Officer at Four Seasons, which is really just a fancy way of helping all of our clinical teams, including Maureen, manage relationships that are more back office oriented, but also really help us provide consistent care. These are some of the things that may not be as exciting as care navigation, like finance and billing, but really it's how that we make sure that we can provide consistent care not once in a while,
No.
but consistently 24/7.
I love that. And Ryan happens to be my senior leader. And I wanted to reintroduce Care Navigation to our audience. So I asked Ryan to interview me. So we're going to switch roles here for just a minute. So I'm happy to talk about Care Navigation today.
Wonderful.
Absolutely.
So I'd like to start with one of the things that's most challenging for us who do this every day. If I know nothing about care navigation and you have a minute or two to share with me what it is, how it can help, how it's beneficial, what would you say?
Right. I like to start by saying Care Navigation helps people navigate healthcare
Mm,
because it's confusing to all of us.
right. Regardless of your age, regardless of your knowledge,
Or
it's
profession.
it's not simple.
It's not
Right,
simple, and
right.
it really is complicated. And what we've been able to do here at Four Seasons Care Navigation is really craft a good niche set of skills for that. So we help people understand what's going on with their medical issues by getting them referred to the appropriate places or coordinating their
I see.
care or making sure that they understand the bills that they're getting or navigating them to appropriate resources. So we used this term when we started this kind of like a daughter by proxy. It's really the sort of thing that maybe your adult child might be digging deeply for you, but your adult children might not exist, or you might want to just have your children might just want to be caregivers or daughters or sons instead of the people going deep for you.
So it sounds like in that scenario, it helps me in the time leading up to doctor's appointments or leading up to those care decisions, but also as other things may come up that help me manage my goals, my life, or just simple things.
It could be from the simplest thing as making an appointment
Mhm.
to a very complex thing of accompanying people or taking them to those medical appointments.
Okay.
And we will make up questions to ask in advance and make sure they all get answered. And as a registered nurse, I'm going to be a nosy nurse and ask lots of questions. And then the complexity goes beyond that appointment to home, making sure that our clients implement whatever was ordered, whatever tests were ordered, whatever medications were changed, what other diagnostics, making sure those are scheduled
Okay.
and making sure they get to them and that they remember to get
Right,
them.
right. So maybe a way to think about that. All of us go to doctor's appointments and there's 1,000 things that are going on regardless of your age and your health, but there are always some things that may get lost in the minutia, may get
So
lost in translation or just how busy we are in our day to day. So that would be a service care navigation could support.
absolutely. And we call that advocacy, among other things.
Okay.
And in fact, a good example there, I was working with a client for many years, and we went to her doctor, and she was living with dementia still independently. And she could really only manage to take her medicines twice a day, even though they were in the blister packs and set up. Doctor wanted to add on a midday dose. And my skin kind of crawled a bit. And I
Yeah.
said, Doctor, please look at a twice daily dosing. How can you alter that so that we can be sure that she takes it? Because I just knew she could not handle a 3 times a day dosing
That makes
because she'd
sense.
proven it before.
Makes sense.
So and the nurse in me knew I could ask that, and others know you can ask that, but I also knew that she couldn't handle what the doctor was asking her to
I
do.
see, I see. So that makes me curious. How do we work with families through care navigation? 'Cause let's just say in that scenario, you're at a visit with my loved one and
Right,
I'm out of the area.
right,
And as we're working together, if I were to say to you, Maureen, I don't know that my loved one is able to navigate the complexity of some of the medication
right.
regimen, that would be something you'd be able to carry forward to that conversation.
Absolutely, particularly if those two entities permit me to talk to each other.
Right. Yeah, yeah.
HIPAA, we
All the rules,
all the
yeah, yeah.
rules.
Of course, of course.
So absolutely, and sometimes it's the family members who will engage our services to help support their parents who are living kind of on the edge,
Yeah,
on the edge.
right.
And so sometimes I give verbal reports or text reports, whatever their preference is, or email reports to the adult children, because many of them, if they're long distance, are the healthcare decision makers. So they need to know what they need to know for
Right.
their mom or dad or grandma or grandpa.
Yeah.
Also, sometimes it's the elder who wants us to communicate. Please let daughter
I
know.
see.
Please let my
I
son
see.
know. I want them to know everything.
So there's a peace of mind effect that comes from
Absolutely.
this work, but also it sounds like in this scenario, you help your clients maintain independence
Yes,
within their comfort level,
right.
within respect to their goals, but also you can help them consider some of these tough conversations. I mean, we all know there's some tough things that happen as you age, like maybe I should reconsider my driving privileges, for
Right.
example.
That's a tough conversation.
Right? So, but you could help in your role
Sure.
facilitate this conversation between the client,
Yeah,
their medical team, and
yeah.
their family.
Right. And that's what we do a lot. For
I see.
example, those difficult conversations. Maybe it is a conversation about changing
I
driving.
see. Yeah.
And sometimes family members and the adult, the client, the person for whom we're focusing our attention want to have a group conversation. We can do
Yeah.
that virtually, we can do that in person. And having an objective third party, I can facilitate or mediate those conversations
I see.
sometimes.
I see.
And honestly, and if I can turn to my audience right now, the real goal is trying to help your loved one who maybe should stop driving, for example.
Mm.
It needs to be his or her idea. And that's how we have the conversation. That's where we start that conversation is the strategy is how do we make that your idea?
Right. And in doing it in a non-confrontational
No.
environment,
Mhm.
it's not an intervention, right?
No, it's
You're
not.
going to say to your loved one, hey, Ryan, here's what we're seeing, here's what we want to
Right.
do, but do it methodically so that it's
Yeah.
not rushed, so that
Right.
there is no antagonistic tendency to it. Um, that so with that, how do you navigate goals that I may have as a client versus
Mhm.
goals my family may have? Because that seems like that could put you in the middle of two
And it
opposing
does.
forces.
It does. So just like my audience has always heard me say, the question that we ask, my favorite question,
Mm,
hospice, palliative, home care, care navigation, I've used this for years.
right,
What's most important to you? What's most important to you, son?
right,
What's most important to you, dad? And they may be completely different. And then we work to see
right.
what does that look like for each of you and see where we
Right.
can blend it so it's
I see.
agreeable for each
I
of them.
see.
It's the most powerful question in the world I've used, and many times
Yeah.
it provokes tears, laughter,
Right, right. I
anger.
didn't know you felt that
I
way.
didn't know you felt that
Yeah,
way.
yeah.
And then you just start bringing those together and see where the commonalities are for the situation. The situation might be another part of what we do is helping people with life transitions. The conversation, this is a difficult conversation.
Mm,
It's time for mom or dad to move to assisted living,
right,
or it's time for mom and dad to bring in more help into the home. It's too much for me, daughter, or me, son.
right,
And
right.
mom and dad may be resistant,
Mhm.
um, although they may have the financial wherewithal to do that,
Yeah,
or there might
yeah.
be programs for that. Those are difficult conversations.
Yeah, it
And it's
is.
just bringing them
It
together.
is.
And I want to tell our audience that everything that we do in care navigation, safety first. If I see something glaringly unsafe, I will address it. It will not become a shadow or swept under a rug. Safety first. So if you're our client, older client who's wanting to get by without driving, for example, and I've seen what you do in the car, I will address it. I have to by law,
Sure.
a good thing, right?
Sure.
Or by, not by law, by my ethics. So
course, of
anyway,
course.
safety over everything, but then we start having those conversations where we start bringing things together
I
to
see.
see if we can.
I see. I have observed personally and professionally, one of the most challenging things about aging is everything you're typically seeing it for the first time.
Right.
And so that can make these conversations very challenging because there may be a little fear, there may be a little bit of like procrastination around these things. It sounds like with Care Navigation, you're really helping our clients, our families, also our healthcare community kind of soften some of those hard edges, make things a little more easier to take bites of versus have fear over, well, if I do this, what happens?
Right. And that, Ryan, you just described perfectly what we do under what the rubric of planning. We plan to have good strategies, to have good plans in place so that when we do have to have difficult conversations, there's a structure there. For example, I want to give this, just met with some clients earlier this week to onboard a couple, and they have planned just about everything.
Right.
Son is far, far away across the country geographically, but he's the only decision maker they have other than themselves. So I planted the seed about suppose something happens to him. So we had that conversation. But then they were very clear, each of them. And these are healthy people, healthy people
Right.
in their late 70s, early 80s, healthy people. They're very clear that should their heart stop beating or they stop breathing, they do not wish to be resuscitated, a DNR.
Ah, okay.
Okay, this is part of the planning conversation. And so I said, well, if that's your wishes, where is that documented? Well, it's in our advance directives, in our
Okay.
living wills. Absolutely. I said, that's great. However, in the state of North Carolina, without that goldenrod DNR that says do not resuscitate, should you stop breathing and your heart stop beating and someone calls 911, our emergency medical providers are obligated by law to resuscitate you. And those are not your wishes.
See, yeah.
They didn't think about that. And then I introduced the idea of a most form to them because they had some other wishes that comes up in what we call the most form, medical orders for scope of treatment. If you're watching from other states, it's got different names in different states and different content.
Just to make it interesting.
Yeah, different content. But I said, you might want to talk to your doctor about that. So that planning, that things to make things softer, it just sets all their plans in place and their wishes in place. And that should we get to a difficult situation, as you put it, it might be a little softer around the edges because the plans have already been made and discussed.
Yeah, that's helpful because the a lot of these situations that we all get in, regardless of your age or your family dynamics, the lack of knowing or the maybe misconceptions that you might experience if you go to Google or something like that can lead to anxiety, a higher, more challenging emotional state, probably conflict internally because everybody's running at a high ebb. So it sounds like there's a calming effect.
It is.
There's a pacing effect from the program. Do you get questions at times of folks saying, well, I'm not there yet?
Oh, yeah.
I don't need that yet. So how do you navigate that? Because I think we all kind of have this idea like, hey, that sounds good for my loved one or for my, my grandfather, but not for me, or my mother, but not for me.
Right.
How do you navigate that?
That's a different challenge. So sometimes when people call and they're just wanting to know, what do I do and how could I help them? And I just had that conversation yesterday. Well, this is not right for me yet.
Yeah.
Well, we might set up a time where I touch base with you again. Or certainly I will share lots of information with people. I believe that people can make informed decisions when they have good information. So I'm always willing to email information to you. And that's what I do with most of these conversations. I'll say, email some information to you and direct you to some other resources so you can think about this to make your own decision.
I see.
Some people just need to know that something exists. Now, they might need my services right now, but it just doesn't bubble up. But usually there's a precipitating event of some sort. The people I met with earlier this week, they said, Maureen, this is the final piece of our planning puzzle. Hey, great. I'm on board to help them. The other couple I talked to, the husband whose wife's living with dementia, he's not quite there yet, but he knows we exist. He knows that Four Seasons can say, yes, we can help you. Yes, we can help you with Care Navigation. Perhaps If you're not ready for that, should you need it, we can navigate you to any of our other
Got
services.
it. Got it.
So that's the beauty, I think, of, I've got a huge bench strength behind me.
Yeah.
Huge.
Yeah.
All the Four Seasons behind me that I can offer services to people so that we can say, yes, Four
Okay.
Seasons can help you because you deserve the right care
That's
at the
right.
right time.
That's right. Okay, well, that's really nice. That's good to know. Another question that comes to mind is we talked about collaboration with medical care teams, your doctor, what have you, your primary care provider. What about if I'm having a conversation with my attorney or my financial advisor? Do you find yourself in those situations where you're collaborating with that side of a client's team, so to speak?
Absolutely, a lot, actually. It's surprising. I didn't expect that when I started into
Yeah.
this. So two flip sides of that coin. We do get referrals, interestingly, from estate planners or financial planners
Yeah.
who direct their clients toward us. And on the flip side, many people who I meet, they actually they have their estate plans maybe from 20 years ago. Or if they don't have any estate plans,
Right.
then I can make referrals.
Sure.
I give them options. I educate them on their options. I accept their choices because I want, they're good people. And we're so fortunate to have great people actually here in Western North Carolina
Yeah,
that can help them with that. But sometimes I'll say, now let's take a look at, when was the last time you looked at your plans? Well, it's been since we did them. Well, when did you do them? 20 years ago. What state? Michigan. It might be time to look at those again. I always want you to look at your plans. I don't need to know what's in your last will and testament. You do. And you need to make sure that the people that are named are the people you want, or the executor is the person you want. Or are your advance directives up to date? I was talking about them, but many people haven't looked at them in ages.
Yeah.
Ages.
Yeah.
I did a recent program on advanced directives, and I always ask the audience, do you have advanced directives? And when was the last time you looked at them? One lady raised her hand and said, 10 days ago. I said, you win the prize. You win the prize. But most of them were several years. So it's just, I do find myself interfacing with the state planners, the state attorneys, certified financial planners, because they are really able to help some of our clients do other creative things legally and financially. And I absolutely know my line. I don't cross a line because I can't give legal advice or
That makes
financial
total
advice.
sense. And I guess with that, it goes back to that facilitation of communication. Because
Yeah.
you're asking those questions, like you mentioned, like when's the last time you reviewed this, Ryan?
Mhm.
When's the last time you had a conversation with your family?
Your family.
With your most involved people, like your spouse or your POA. That sounds like a really good conversation, and it pushes in on some things that most of us would consider tough conversations, wouldn't you
Yeah.
say?
Oh, yeah.
There's morbidity associated with
Yeah.
it. There's fear. None of us want to get older.
No.
Every time we look in the mirror, we're thinking, who is that
Where's
person?
that come from?
So with these conversations, it sounds like it's a very comprehensive support.
Yes.
It's not limited to diagnosis. It's not limited to where you live. It's not limited to age. So really somebody could come to you, like I could come and say, hey, I want to make sure that I've thought about this well.
Yeah.
Even though my life expectancy doesn't have a shelf life as far as I can see, that's a relevant conversation.
Sure.
Okay.
In fact, just this week we onboarded someone who's 48 years old, who's needing help with getting permanent disability because of a head injury. You would never expect that.
Okay.
She's run into trouble in the system. So we're going to be her advocate.
So if I were somebody who's not really sure if this is the right program for me, my family, or if it aligns with my needs, is there a way to kind of test drive Care Navigation?
Absolutely, absolutely. You can call us at 866-466-9734 and ask for a referral to Care Navigation. I'll be glad to talk to you just to give information, and so you can decide if this is for you.
I like that. And so just one quick clarification there. So when Maureen says referral, what does that mean? That's a self-referral, right?
Self-referral.
That's me raising my hand and saying, I'd like to learn more.
Yep.
I'd like to take an active role in getting to know more about the
You
program.
do not need a physician's order for this. This is not a medical model at all. You just say, hey, I want some more information for myself or my family members or friends.
Yeah.
I will talk to anybody.
That makes sense. And so even though that Maureen is an RN and other team members might be an LCSW or others, it doesn't mean that this is medical care you're receiving. It's support, it's the planning, it's the advocacy. So in many ways, it sounds like it's an ally. It's
I think so.
a resource for you to help you grow. So one of the biggest things that I've learned and really appreciated about this program over the years is there's not a one size fits all. We want to meet you where you are, and that can be regardless of who you're concerned about, your loved one, that could be your partner,
Mhm.
could be yourself. You could be
Yes.
doing scenario planning. We all have relatives. You might call and say, "Hey, I'm 50, but my father died at 60. What should I be concerned about? Because I saw what happened when my father passed. I
Yes.
want to give a gift to myself and my family and be prepared as possible."
I love that idea. Please do that.
Yeah, yeah. And so the other thing that I think often comes to mind as we talk about things like this is it's not based on the size of your estate. It's not based on where you live.
No,
It's we'll meet you where you are. Is that
that's
fair to
right.
say?
Absolutely.
I
Absolutely.
like that.
And I will say, many people ask, is this covered by health insurance? It is not. It is a private pay service, I'll be honest. But don't let that scare you. If you have limited or no income, we are so fortunate here at Four Seasons to have funds that donors have provided so that we can help people regardless of ability to pay, even for care navigation. I'm very grateful.
Yeah,
So we'll get you pointed in the right direction.
that's fantastic.
Mhm.
Okay, so let's just go back to how do we learn more?
Call us two ways at 866-466-9734, or please go to our website, fourseasonscare.org. There are multiple ways to send in an inquiry, and I do get inquiries from the web. So we'll help answer your questions or at least get you pointed in the right direction.
That's right. Yeah, and one of my favorite things about what we do here is even if you call us and maybe what you're looking for is not necessarily care navigation, we won't leave you alone. We'll help you get to that next resource. That's one of our favorite things, along with what Maureen said a moment ago about regardless of your ability to pay, if the private
Yes.
pay is a concern, we'll take care of you because it's the right thing to do. And the beautiful thing about that is it's true of all of our services.
All of
So
our
it's not
services.
just care navigation. We will find a way to help you or make one. This has been a great conversation, Maureen. Thank you so much.
You're welcome. I'm glad to do it. And thank you
My
for
pleasure.
doing the turning the tables with
That's
me.
right. Yeah. It's like a reverse one-to-one
I
over
would,
here.
well, you can call us about anything at Four Seasons, whether it's about care navigation or any of our services. Ryan or I or anyone who answers a phone would be delighted to get you pointed in the right direction. That's a privilege. So thank you for viewing today. So join me again on Monday, August the 4th, 2025 at noon for another episode of Ask a Care Navigator, where I will be introducing or reintroducing another Four Seasons service. And please know it is a privilege to be of service. We want to help you. Thank you.
Thank you.